Thank you, Patrick. So today I'm going to talk about population analytics prototype. Now, this prototype is designed to perform population analysis, which is the examination of specific group of individuals within a larger population. We have considered patient data that is coming from hospital operations and ambulatory operations, and we have considered the demographic information. And we have leveraged three assets. Number one is social determinants of health factors. There are 7 factors that we have considered in this prototype, which we'll take a look at shortly. And these 7 factors are used to derive a quantitative value that tells you the level of deprivation experienced by individuals and communities. The second is the health risk score model, which is used to derive the health risk score for an individual, which tells you the level of risk for developing certain health conditions. And the third one is the healthcare utilization, which is the ratio of hospitalization days to the patient population, which is used for a ranking measure. Now let's take a look at the prototype to see how we have displayed this information. So for this prototype, we have considered data for only one hospital, and all the patients live in the Ohio state. Now, these are the area maps. This page, STOH, displays the quintile information at a zip code level. The higher the value of quintile means the higher the level of deprivation experienced by certain communities and zip codes. Looking at Columbus area, clicking on a zip code, you will see that these are the 7 factors that I was referring to. And you can also see the population within that zip code along with the quintile information. Over here, we have maintained the same color schema so that on the pop-up page, you can see what is the level of deprivation. The second is the health risk, which health risk quintile, and this means the higher the value of the quintile, the higher the risk the patients are to develop certain health conditions. And looking at the same zip code, you will see the quintile value, the patient IDs, their risk level, and the risk scores. The third one that we have is the healthcare utilization. The higher the value of quintile means the more resource utilization has been done in a specific area. Looking at the same zip code, you will see that these are the patient IDs, their inpatient days, their ED visits, and observation visits, which are used to derive a score. With this pop-up page also displays the information about the quintile and the patient population. The fourth page that we have for area maps is the composite, and what this does is it combines all the information about STOH, the health risk, and the healthcare utilization in one page, and the composite quintile value is derived from all the 3. We have similar information at a county level, and we can also add information at a census tract level, which is more granular than a zip code, and also at a primary care service areas. The second set of pages that we have are interactive analysis page. So these pages are basically designed to do analysis at different area levels. The theme for all these 4 pages are the same, where you'll have city, state, zip, the census population, the patient population, the quintile, and the percentiles. When we look at the health risk, you will see that we can, click on the quintile values, the percentile values. There are also columns which tells you information about the number of patients with a higher risk patients. For the utilization, there are hospitalization days measures so that you can clearly see, what are the scores, what are the percentiles and quintiles. And the fourth page, which is composite, it brings all the quintile and percentile information in one page for more analysis. Hopefully, this presentation has given you an idea on how we can combine multiple DI application so that we can do population analysis in a more powerful way. We would love to hear your feedback in the chat. Thank you. Back to you, Lindsay.